Thank you for inviting us to the University of Michigan's Diversity in Medicine Conference. We are pleased to have the opportunity to present Beyond Mentoring, what student doctors learned from an intervention program with teen mothers experiencing homelessness. Background. As many of you may be aware, the effects of childhood trauma seep into adulthood, plaguing generation after generation due to the permeating nature of adverse childhood experiences. Fortunately, strong evidence shows childhood trauma and its sequelae can be buffered, treated, and even prevented with a compassionate and reliable caregiver. However, in central Massachusetts, optimal mentoring with potential to break intergenerational trauma is currently lacking. In this pilot intervention, a professional parenting educator designed a curriculum and trained volunteer medical students to bring evidence-based, trauma-sensitive workshops directly to a shelter for young mothers experiencing homelessness. The overall aim was to bring trauma-sensitive care to this community, train the next generation of physicians as advocates, and examine how a trauma-informed intervention may affect stress levels, parenting knowledge, and self-efficacy in a chronically stressed and underserved population. To assess the impact of this project, data were collected from surveys, focus groups, individual interviews, and hair cortisol samples, a biological indicator of chronic stress, from an intervention and comparison shelter for young mothers. After the workshops and data collection, medical students continued visiting the shelter weekly as mentors in hopes of building longitudinal relationships. Outcomes. Though our sample size was small, in part due to the transient population, the mother survey data from the intervention shelter showed an increase in trauma-informed parenting and self-efficacy scores, as well as a decrease in perceived stress levels. Hair cortisol change results were mixed because, in part, cortisol can either be elevated or blunted in response to chronic stress. In the focus group, one mother summarized, quote, "I realized I needed to take time for myself to be a better parent to my child and cope with what I went through. The program opened my eyes." Medical students came away from the program reporting that they had gained more from the experience than perhaps the intended audience, the young mothers, who ultimately became the budding physicians' teachers. Specifically, students reported being inspired from their mentees' resilience, increasing their practice with difficult conversations surrounding trauma and mental health, gaining experience in active listening and teaching, and obtaining a true window into the lives of homeless adolescent mothers, an often stigmatized group typically left out of formal medical school curricula. Conclusions. In summary, medical students were professionally trained to deliver an evidence-based, trauma-sensitive parenting and mental health curriculum for young mothers experiencing homelessness. Preliminary data indicated improved trauma-informed parenting scores, self-efficacy, and perceived stress levels. More striking, medical students reported newfound sparked passions and meaningful learning experiences in advocacy work. Further studies are needed to take a closer look at the biopsychosocial impacts of programs for underserved women. While our pilot sample size was small, we hope that by educating the next generation of physicians, our work will have a ripple effect, and our cohort will continue to advocate for adolescent mothers experiencing homelessness, a patient population typically missed in medical school curricula. Lastly, thank you to the conference organizers and all who made this work possible, especially the inspiring young mothers.